Welcome to Living Fuel TV. I'm Craichy bringing an important health alert. Is your multivitamin killing you? Is it just worthless? Bloomberg reported over the last couple of weeks, as did every major media outlet, that multivitamins and some dietary supplements used regularly by an estimated 234 million U.S. adults may do more harm than good. According to a study that tied their use to higher death rates among older women, the study's authors outrageously concluded, "We see little justification for the general and widespread use of dietary supplements." This study was published in American Medical Association's Archives of Internal Medicine, a very prestigious publication. But this is junk science. This is absolutely junk science. 29,000 women, average age of 62, were asked to take a survey about their multivitamin and supplement use. 11 years later, in 1997, they were asked again to take a survey about their multivitamin and supplement use over the previous 11 years. Subsequently, in 2004, they did another survey, asked to do another survey, accessing the memories of 80-year-old Americans to find out what they have been eating or taking regarding supplements and multivitamins over the previous 19 years. So this is a 19-year study done with surveys of people's general use of supplements, and they concluded things out of these surveys that were absolutely ridiculous. In fact, their findings were statistically insignificant anyway, yet they were published by this leading journal. Dr. Robert Ververt, the executive and scientific editor of Alliance for Natural Health International, said, "This study is a classic example of scientific reductionism being used to fulfill a particular need. In this case, it's supplement bashing, a well-known preoccupation of Big Pharma, and an approach that appears to be central to the protection of Big Pharma's profit margins." Guess what, folks? Dietary supplements can do just about anything that pharmaceutical drugs can do, if you have experts, if you understand how to use them and what to use. But this dietary supplements save lives. They extend life. They delay disease. There have been numerous studies on multivitamins extending life and reducing the reduction of telomere links on the DNA protection. There's been so many studies that show various dietary supplements do various things to increase lifespan or quality of life. This is an attack on supplements. Now, my wife, I do not believe, may not even be here today, may not have lived were it not for supplements when she went through her experience with suicidal thoughts and clinical depression and panic attacks way back when. My wife has not had a pharmaceutical drug in over 17 years. So this study is absurd, and it really needs to be, the major media needs to write a retraction or put some more information out there, because it is totally irresponsible what's been done here. I want to suggest a study to you. How about we take average age 62-year-old Americans, women even, 29,000, the very same group that they use in this study. And let's say, since the average American is on 6 pharmaceutical drugs at age 62, that we will take those 6 drugs and we're just going to call them a multi-drug instead of a multivitamin. And let's do a survey, 3 times over 19 years, and then we'll ask whatever 80-year-old American is left out of that study at the end, what they did over the previous few years, and then we'll determine how many of them are actually alive at the end of that study. I suspect not many. So I just wanted to put this straight. I hope it was helpful to you. God bless you, and have a great day.